Hello, everyone. I'm incredibly pleased to welcome you all here to our webinar today. Win, lose and draw, alcohol and other drug policy in elite sport. Today's session is really about getting the balance right for players and for clubs and codes, ensuring that organisations have the most effective policies and procedures to manage risk, prevent harm, foster peak performance, and ensure that players who use alcohol and other drugs get effective supports. Before we begin today, folks, I'd like to offer an acknowledgement of the traditional custodians of the lands upon which we meet and the lands of which we work and play. We recognise the ongoing impact of colonialisation and dispossession on First Nations people, and we pay our respects to elders, past and present, and of course extend a very warm greeting to any Aboriginal or Torres Strait Islander people joining us today. I might tell you a little bit about 360 Edge before we jump into the content today. If you haven't heard from us, we are 360 Edge, Australia's only consulting company dedicated to effective and evidence-based alcohol and drug responses. I want to briefly introduce my colleague, Dr Katinka van der Ven, Principal Consultant at 360 Edge. Katinka is going to give you a bit of an insight into her background and special interest in drugs and sports in a moment. But I'm also incredibly pleased to say we have a special guest today, Dr. Naomi Spears, who's the Director of Anti-Doping Projects at Sport Integrity Australia and a member of the World Anti-Doping Agency Laboratory Expert Group. And Naomi's kindly offered to participate in the Q&A section at the end of our webinar. So what are a couple of psychologists talking to you about elite sport? I managed 20 push-ups this morning, and that's a really good day for me. So I should probably explain a little bit about why we're here. We've got a number of program areas that we're particularly interested in, all of which focus on ensuring that policies, procedures, programs for people experiencing any difficulties with their drug and alcohol use are as effective as possible. So we develop treatment programs, we evaluate programs, we do a lot of development, and we also contribute to effective policies in organisations, both in high-risk industries, and of course today's focus is on sport. So a little bit of an agenda for today. We're going to lay out, I guess, a bit of the background for some of the big issues facing athletes, particularly at elite sport level. We're going to talk a little bit about what effective policies look like to manage and respond to risks and issues. And then we'll have a bit of time at the end for a brief Q&A section. So please feel free to click on that Q&A button or use the chat, ask us your questions, and we'll regroup at the end. But for the interesting content, I want to hand over to Katinka.
Thank you, Richard. As Richard said, I would just give a little bit of an introduction in terms of my background. So I have been working in the alcohol and other drugs use in sport area since 2012. And basically what triggered my interest is that, you know, back in the day, my brother and I were really involved in bodybuilding, and we were doing that on a relatively high level. And at a certain point, he was offered steroids, which back then, you know, was something I knew nothing about. So it was really, for me, came as a surprise. And I basically got really curious as to, you know, why people were using these substances and how they actually also would obtain them. And my initial research was actually focused on the trafficking and manufacturing of anabolic steroids and other enhancement substances. But this has really switched to more so focusing on improving health services for recreational and elite athletes who are experiencing harms from the anabolic steroid use, but also for other substances. And my work has ranged from developing clinical guidelines to developing alcohol and drug sport policies and training of clinicians and harm reduction workers. So before starting as a principal consultant at 360 Edge, I was an academic, having worked for, amongst others, the University of New South Wales and the University of New England. And I'm also the founder and director of the Human Enhancement Drugs Network, which includes over 120 members from across the world, which involves individuals and organizations from sport organizations, anti-doping organizations, health services, universities, and also people with lived experience. So that's just a little bit about me. So we know that alcohol and other drug use occurs within different types of sports amongst male and female athletes, and basically happens across the globe. And what is important to note is that the issue with drug use is not usually just the drug use itself, but it is actually the behaviors associated with being under the influence, such as sexual and physical violence. And that's also really why with this webinar we want to explore conduct and other policies to manage these infractions, and not just focus on drug-related bans. So in terms of the prevalence of mental health and alcohol and drug use in sports, we know that unfortunately the data that is Australia specific is quite limited, and we also know that the data that does exist is quite old. But there is some data, but that is often sport specific. But we do see that evidence from other countries shows that prevalence rates are relatively similar. So in terms of mental health, the evidence shows that elite athletes experience mental health disorders on a similar level as the general population. So in Australia, it has been reported that almost 47% of Australian athletes experience a mental health disorder, particularly depression and anxiety are commonly reported. And it has also been well established, the evidence shows that mental health problems are often associated with alcohol or drug use. And that is no exception when it comes to athletes. So for example, as a way to cope with anxious feelings someone is experiencing. Elite athletes, however, generally use less alcohol and illicit drugs compared to the general population. But this is really dependent on the type of drugs used, the type of sports we're talking about, and also actually the time of the year. So an Australian study showed that 7% of elite athletes had used illicit drugs in the past years, with cannabis and ecstasy and cocaine being the most commonly used. And when we look at the general population, we see that around 18% has used illicit drugs in the previous 12 months. But actually, when we are looking specifically at alcohol, the evidence shows that it's regularly reported as an issue within elite sports. So looking, for example, at a study focused on Australian Football League's athletes, it showed that although risky use is typically lower for athletes during competition, which is around 2%, and whereas this is around 15% for the general population, risky use was actually found to be much higher in the AFL player during the end of the season period, being around 54%, which is quite a concerning number. And although this study was done on an elite level, we know that alcohol use is also common amongst amateur athletes, and is often very much part of the sporting culture. It's part of, for example, as a bonding experience between athletes. So athletes use alcohol and other drugs for a range of reasons. In a sense, they are no different from the general population in that they will use alcohol and other drugs for social and recreational purposes, to manage pain and injuries, elevate anxiety and symptoms of depression, reduce stress, improve sleep, boost energy, and to cope with post-retirement unemployment. At the same time, athletes are different from the general population by their commitment and dedication to training and being in the public eye for both their on-field and off-field behavior. And adding to this is that everything is regulated. What they eat, when they sleep, and so on. So athletes are also subject to doping controls, and very few of us normal folks would be able to tolerate the regime of testing and surveillance elite athlete is experiencing. So it is also therefore no surprise that the sport culture and environment also plays an important role in alcohol and other drug use amongst elite athletes. So being part of a sporting culture that normalizes or permits alcohol and other drug use, overwhelming use among peers, knowing other athletes who use drugs, having an opportunity to use or identify as a full-time athlete can increase the likelihood of alcohol and other drug use amongst athletes. Adding to this, to that is that athletes are facing immense pressures to compete, to constantly better themselves. So all athletes, need to be faster, higher, stronger, as the Olympic model also highlights. So some athletes, as a result, will resort to substances to enhance their performance. And the enhancing of performance is something that already happens on a grassroots level. So research shows that most substances used to enhance image and performance is actually used within recreational settings and not necessarily sport settings. So, for example, an Australian study showed that 51% of male gym users had used non-prescribed steroids and other enhancement drugs. And although many amateur and recreational athletes will use enhancement drugs for cosmetic reasons, so, for example, to become more muscular. There are also, those like young athletes who will start using steroids and other enhancement substances to increase their, sport performance in the hopes that one day they will become an elite athlete. So what impacts does alcohol and other drug use have? So research shows that alcohol and other drugs use can be beneficial. So for example, think of opioids and cannabis use that can help reducing experience of pain related to sport injuries. Many people, including athletes, also use substances for pleasurable reasons and can do so without experiencing problems with their use. The evidence, however, also shows that alcohol and other drug use for some can lead to serious physical and mental health issues. And for elite athletes, there are also a couple of other considerations when it comes to alcohol and other drugs. So alcohol and other drugs can impact an athlete's sport performance. So for example, taking alcohol as an example, again, it can affect an athlete's sport performance for up to 72 hours after their last drink. It can negatively impact motor skills, balance, hand-eye coordination, sleep, and reaction time. And exercising the day after drinking alcohol can lead to an all-round lower quality training session or sporting performance in competition. It can also lead, of course, to a positive doping test if the athlete does not have a therapeutic use exemption for the substance they're using. This can have serious consequences, such as a ban from the sport, in some cases needing to pay a fine, and in some cases an athlete needs to fully retire from the sport. So it can also lead to reputational damage for both the individual as the organization. And this doesn't only apply for when an athlete tests positive, but for example, think of an athlete being a target of social media for inappropriate behavior while being, under the influence at a party. And adding to this is that many sport organizations don't have any policies and procedures in place when an athlete is experiencing problems with their alcohol and other drugs use. Most don't know how to respond, and athletes are often on their own when it comes to dealing with this. So at 360 Edge, we therefore often support sport and other organizations with developing and implementing alcohol and other drug policies. So, what does an effective policy look like? So one of the most common mistakes we see workplaces make is introducing testing but not having a comprehensive policy in place that takes a fit to work approach, covers training for relevant staff and managers, reasonable measures to respond to risk, an avenue for support, and a clear outline of testing procedures and consequences of positive test results. So drug testing without a proper drug policy increases the risk of discrimination and unfair treatment of people who use both illicit drugs and psychoactive medicines. So, of course, for athletes, testing for illicit drugs and doping substances is mandatory. But often no processes are in place to support an athlete when they test positive for illicit drugs. A strong focus is on, banning the athlete from the sport and not actually addressing the problems an athlete is experiencing and what the athlete is and what substances the athlete is using and what for. And because as noted before, many substances are not necessarily used for doping or enhancement reasons. And the other issue is that problematic alcohol use is generally not picked up as it is not tested for. So being involved in sport adds this additional layer due to the issues of anti-doping policies, making it even more important to have clear policies in place to support athletes who are actually experiencing problems with their use. And testing for alcohol and other drugs should always be accompanied with a strong policy. And it basically exists of 3 layers. So I'll walk you through it, but what we see now is basically the first layer. So the first important ingredient of an effective alcohol and other drug policy is that it should be underpinned by harm reduction. So harm reduction is a key guiding principle across illicit and other drug responses in Australia. So the aim of harm reduction is to protect individuals, clubs, and the game from the, and professional sport organizations from the adverse impacts of illicit and other drug use. Harm reduction not only supports the athlete's health, but can also uphold the integrity of the sport by promoting a culture of safety and responsibility. It ensures a reduction of specific risks, harms, and liabilities. And part of this is that there should also be focus on early intervention, and that evidence-based education and training is in place. So, a lack of an alcohol and other drug policy is basically, a recipe for disaster. And a policy can only be effective if it's integrated into day-to-day operations. And effective dissemination of the policies and the procedures to the entire sport organization is crucial for success. And dissemination goes beyond simply, circulating the documents for tick and sign. Adequate training for athletes is required, as training for managers, support personnel, and supervisors, and on how to implement the policy under real-world condition and how to support athletes. Effective dissemination of a policy that takes a well-being approach will also positively influence development or strengthening of a sport culture that is intolerant of risky alcohol and other drug use. So the second layer exists of clearly documented policies and procedures. So the policy and accompanying procedures should describe what is and is not acceptable for athletes in relation to alcohol and other drug use. Documents should also indicate clearly what will happen if limits are breached, and provide detailed instructions in the steps to be taken for whom and when. The documentation should be reviewed and updated regularly to, reflect any organizational change. And within these policies and procedures, there should also be a clear focus on athlete health and well-being, support and referral options for those needing assistance, or, identified as unfit to play is a necessary component of effective policy. And sport organizations should ideally have a list of support services that can assist athletes with a range of issues, including physical and mental health problems related to alcohol and other drug use. So finally, the third layer is the most important one, is that the policy should have a general focus on being fit to train and play, not just have this really specific focus on alcohol and other drugs, but focuses on a range of issues that can influence the performance and health of an athlete. Being fit to play and train describes a player's capacity to play and train without risk to themselves or others' health and safety. So the ability to play and train safely and skillfully can be affected by multiple factors, including stress and physical and mental health problems. And in many cases, the signs can look a lot like alcohol and other drug use, which can sometimes lead to incorrect assumptions. So an effective alcohol drug policy therefore focuses broadly on being, fit to play and train rather than, zooming in necessarily on alcohol and drugs specifically. So I'm now handing over to Richard, who's gonna walk you through a project that we recently completed.
Thanks, Katinka. So this is the how does it look in practice section, and we've got a bit of experience designing and developing and implementing alcohol and drug policies, particularly with this focus on prevention and early intervention, and then the sort of resources and processes that are required to get it working. And given the specific risks that Katinka was just mentioning, and the sort of disproportionate harms for elite athletes, their sort of career, reputational issues, the club, if you like, and even the sport more generally, important to couple that early intervention approach with a low threshold. So essentially assessing and intervening early at the earliest signs of drug and alcohol use, and particularly problems associated with drug and alcohol use. So there's some principles going in. We worked with a major sporting organisation recently, essentially helping them develop a new illicit drugs policy, but then thinking about what does that actually look like in practice, given that there are a number of stakeholders involved in supporting the rollout of a policy and the running of the policy in day-to-day practice. And this was a balancing act, a very fine balancing act between awareness and consciousness around sanctions, a really firm sort of prioritisation of the health and well-being of players, managing the reputational risk. Often there are national and international rules and regulations, and considering also some of the pressures that society puts on, particularly elite sporting organisations, to kind of carry and manage significant risks around stigma and moral judgment that is attached to particularly illicit drug use. But again, to echo what Katinka says, when you dive into that a little bit, you find that a lot of the stigma and judgment isn't essentially related only to alcohol and drug use. It's the behaviours that come along with drug and alcohol use where most of the red flags tend to get tripped. So I want to take you through our process very quickly. Given that we would like effective policies to reflect what works, we started that process with an evidence check, essentially looking at the published literature to identify best practice principles that could inform a illicit drug policy in a professional sporting context. We also looked at the drug policies for comparable international and national sporting organisations, essentially to benchmark how are other people responding to this. And I think some of Katinka's comments about few organisations really having really well-documented procedures, probably coming from that piece of work we did. So we definitely zoned in on harm reduction approach being really important, strong emphasis on prevention, that effective education, including not just the players, but everyone involved in player wellbeing and performance management, thinking about what treatments work should someone start to experience some difficulties, and through all of that, maintaining kind of the organisation's responsibility to its stakeholders and also the confidentiality and privacy of people who might be affected by the policy. So that stuff was sort of done as a desktop review. Then we jumped into a lot of extensive consultations with people involved in the sport, current players, past players, management, coaches, lawyers, sort of union representatives, if you like, to get an understanding of their perspectives and their needs. This is a really important part of policy development, because effective policy really needs to allow for all of the stakeholder needs, the people that are going to be participating, to align with the values of the organisation, the perspectives of and beliefs of the people the policy affects generally. We consolidated all of that information and developed some detailed policy recommendations, which allowed our client to then revise and develop a evidence-based effective illicit drugs policy. But that was just part of it. Once the policy was there, we supported that organisation, particularly around implementation of the support component. So this was a clinical protocol to manage and support players who tested positive or self-identified as having difficulties with illicit drug use. The clinical protocol is designed to provide guidance to support sort of pathways. Where should someone go and when? But at a deeper level than that, some of the clinical decision-making about the most effective, the most appropriate treatment and support responses, essentially so that people get consistent responses to behaviour. And we've got some confidence that the treatment and support provided are going to be effective. So the protocol is kind of a complex diagram in some ways. We might show it on screen. Please don't break your retinas trying to read this, but a reasonably complex set of steps to enable the organisation to understand the nature and extent of use, to assess that really well, to think about mental health, physical health implications, and then to match athletes with appropriate and tailored support. And we included alcohol in our clinical protocol, and alcohol is not one of those testing flags, but certainly an issue in terms of player health and well-being. And alcohol is a bit of a stalking horse in illicit drug use. You know, thinking about what are the factors that tend to predict players using and experiencing difficulties with illicit substance use, more often than not, alcohol will be part of that context. So we included that around particularly screening and assessment. So the organisation we worked with is now using the policy advice, using the clinical protocols to develop education, behaviour change programs, and ensuring that athletes and other stakeholders are informed about how all this is going to work. Back to you, Katinka.
Thank you. So yeah, just to summarize everything that Richard and I have discussed. So testing only is not effective. A fit to train and play approach should be central, not just having an exclusive focus on alcohol and other drug use. A policy needs to be underpinned by harm reduction and early intervention principles. Very important, policy needs to be developed in consultation with athletes and other important stakeholders. It needs to be accompanied by education and training. And a clinical protocol and other guiding documents should be in place to ensure the policy is most effective. And of course, support and treatment should be available for those who need it. So thank you so much for joining in for our webinar. We'll now open up for questions. And I believe that we're gonna let in Naomi so she can be part of the question round. There she is.
Howdy, Naomi. I've got a general and a specific question for you. I might start with the specific one. I'm just hoping you can give a reflection on Sport Integrity Australia's kind of perspective on what you see in terms of organisations responding effectively when athletes are having difficulties with illicit drug use.
Well, so my area is the anti-doping area. So I'm not going to talk generally about kind of the NIF components of illicit drug use. But I think definitely we see national sporting organisations interested and invested in the well-being of their athletes, and obviously with differing levels of resources to implement that. So if an athlete tests positive to any substance, then we encourage the sport to provide well-being support to that person, and we have some general well-being information that we provide. For illicit drugs, there are 4 specific ones that are under some special rules called the substance of abuse rules. So that's cannabis, cocaine, I'm going to forget what the other 2 are, heroin and MDMA. And for those 4 substances, then if an athlete can establish that their use was out of competition and not related to sport performance, then it really does move into a treatment line. And the athlete sanction will be reduced to 3 months or down to 1 month, depending on whether they're willing to engage in treatment.
Right. And, maybe a sort of a general question too, because that speaks to the availability of advice for sporting organisations and something that Sport Integrity Australia is supporting. I'm just wondering about the more grassroots level, and two, what your perspective is on whether or not what we've been talking about today applies only to elite sports, or whether there's something beneficial to filter through to more grassroots or community codes.
Well, look, I would say definitely through all levels of sport, illicit drugs is a whole community issue that's present and potentially exacerbated in sport. But all levels of sport will have those considerations. And in particular, play by the rules is not part of SIA, but an organisation who work really closely with SIA in supporting community level sport with education resources in that across all types of spaces, including like drugs and child safeguarding and those components. So people could look up, like Google play by the rules for that kind of information in community sport.
Fantastic, Naomi. And that's a nice call to action there. We've got one question here from Jake. How much agency do Australian sport organisations have in setting the rules around prohibited substance or treatment plans, particularly if athletes are looking to compete at global levels later on? Oh, I think we might have lost Naomi there. Apologies, Jake. And for anyone else who has a question, I think we might try to reach out to Jake and answer that question. Naomi's back. Welcome back, Naomi.
Sorry, I'm on my phone. It's cutting in and out. The level of agency that national sporting organisations have?
Particularly if a player is going to go onto a global level afterwards, how much can they set standards around prohibited substances or even treatment plans?
So in the anti-doping space, the prohibited substances are set by the prohibited list, which is set annually by WADA. And so we don't actually have any agency in what's on that list, and nor do national sporting organisations, but nor do international sporting organisations. So that list is set once for everyone. In terms of treatment, like if you're getting into the substance of abuse and athletes tested positive to cocaine, then we would absolutely be working closely with the sport to understand what treatment program might be best suited to their athlete. And if we made a decision about that and hence the athlete got a 1 month sanction, it would be highly unlikely, though theoretically possible, that an international sporting organisation would appeal our decision in that space. So that would be accepted internationally.
Yeah, in terms of a sanction response, I could understand there being a bit of uniformity. And Jake, maybe as speaking as a drug and alcohol clinician, I would say that a treatment plan or the kind of therapeutic response that someone got, you'd really hope would be guided by the evidence. And just to echo what Naomi just said, you'd really hope that that was an individualised treatment plan, essentially responding to the specific needs that athlete had. However, there is a considerable amount of variability. And one of the issues there is it's quite difficult to get practitioners who are experts in drug and alcohol treatment, but also understand some of those context factors that Katinka was talking about before, about those specific risks and impacts on players' careers once they've been found with a drug and alcohol problem. And one of the reasons why the clinical protocol part is so hard, so that you're saying if we've got a big sporting organisation made up of lots of individual clubs, we've got some consistent advice about what effective evidence-based treatment looks like. And if you're keen to find out more about any of this, please don't hesitate to get in contact with us at 360 Edge. more questions, more comments, or perhaps a query about how this might apply to your sport or your club or your code, we'd be delighted to speak with you. Huge thanks to my colleague Katinka and to Naomi for joining us whilst mobile, and hope to see you in the next webinar. Thanks very much.